I am Dr. Franklin Silverton Wisi, a global health expert and future leader from Cameroon. I'm with Dr. Nick Vanyam, a health leader in Cameroon, and I'm privileged and amazed to be discussing with him about funding of healthcare in Cameroon. Thank you, Doctor, for honoring this invitation.
It's a pleasure to be with you, and I think I'm going to make use of this more than you.
Thank you. So please, could you just introduce yourself?
Well, I'm Dr. Nick Ngwanyam. I'm 65 years old now, and I studied medicine in Cameroon, in Nairobi, and in London, and I've traveled a lot, and I've seen what people do elsewhere with their healthcare and how that healthcare fits into the general economy of the nation. And these things cannot be split. When the economy of a nation is doing well, the healthcare also does well. So there's a lot of things that are hooked in, and I've been working a lot on all of these. I've been working a lot on training of the youths to be able to meet our needs, because I think that we as a people must rise up and face our health challenges and solve the problems ourselves in as much as we get help.
Thank you very much. They say if you want to see far, learn to stand on the shoulders of giants. I'm standing on the shoulder of a giant. And I will be asking, though, there is this concept of budget execution, budget commitment, and the one that is being executed. In Cameroon, the budget that is being executed stands at 53%. That's health budget executed.
Yeah.
Yes. Why do you think when budget for health is allocated, only about 53% of it is executed?
There are many reasons to account for that. There's budget allocation. Budget allocation is just the agreed amount that will be spent in the health sector for the various activities and so on. That might come up to $100, for instance. But at the end of the day, at the end of the year, when you do the books, you see that probably only the 53% of that money has been spent on health effectively. So you're asking the question, so what happened to the rest of the 47%? Where did it go to? Why wasn't it spent? And if it was not spent, the things that were supposed to have been bought with that money, did they happen? So there must be a problem somewhere, right? So sometimes, a budget is put on paper.
Yes.
But a budget on paper is just ink on paper. There must be money.
Yes.
There must be money in the pockets that has to be spent to achieve those things. Then besides that, don't forget there must be efficiency and effectiveness in the use of resources. So you could still have a lot of resources. Actually, there could still be 100% use of that money.
Yeah, budget
execution, but you realize that the effectiveness is not much. The effectiveness sometimes might not be more than 25%, because you could take the cars and money and buy yourself cars, go on trips, field trips, and hold seminars and so on, and do things that don't really impact the health of the people. So these are things that we need to look at. And then sometimes when a government says we're going to spend so much, and then they're expecting money from these different sources to put into that budget, and the money doesn't come, and therefore besides the corruption, of course.
Okay, thank you very much for those highlights. So the budget that is being committed and that which is executed needs to have some kind of relation, some balance, and there should be effectiveness and efficiency in the way of spending the budget.
The human factor is very, very important in that budget execution. The human factor.
What do you mean?
It accounts for a lot of wastage. The human factor is what blocks most systems.
Okay.
You can put in place anything, it can be very beautiful on paper, you can provide all the resources, but the human factor is the key thing that makes systems to fail.
Okay.
I can talk about it all day long because I run the institution, the St. Louis University Institute of Health. And I've been doing that for a very long time, so I know about the human factor. I know about human weaknesses. I know how we train in the nation, and I know the mindset of the people. So there is this mindset, or how should I put it? The way a people think in a community, it matters a lot. If people adore rich people and don't care where the resources are coming from, and would adore you and praise you even if you stole the money, then that system would function different.
I get you. The human factor is very important. So what can be done to ameliorate this human factor?
Well, it's about training in the whole nation. It's about the vision. It's about leadership. You know what I've been saying. You can put it under governance. It's about the governance structure in the nation. How are the systems governed? What are the values? If those things are not made clear, and if people cannot distinguish between their private pockets and government pockets or common good, then there's always a problem. And you might think that it's poverty that is making that happen. No, it's not poverty. It's the human character. It's training. There are some communities that are very poor, yet people respect what is common good. And there are some communities, the way we're going, there are some communities are very rich, but you might have individuals who are very rich, so to speak, but the commoner is very poor. And in those communities where the values are not, respected, and we just worship wealth just for the sake of it, those kind of communities cannot grow.
I get you. Thank you for that. And according to Global Fund estimates, the general government health expenditure stands at 3%. Out-of-pocket health expenditure, 73%. External funding for healthcare stands at 14%, and insurance or other sources about 7%. How can we explain for such a status quo that out-of-pocket health expenditure in Cameroon is very high, but that of the government is low? And what can be done to change the status quo?
The part paid by government is very low. And if you wanted to change it, then you have to make a policy to say that healthcare is free and make sure you provide it. At that time, the government will have to pump in the money, and then the expenditure will go up. But as long as you have not said that, as long as the government has not said that it is responsible for 100% of the healthcare of its citizens, then when people are sick, they must pay the money, otherwise they die. So health is a primary need, and so people will pay for it out of pocket to stay alive. But the question is, when they pay for it to stay alive, what are they sacrificing to be able to pay for it? Are there ways that people could pay for it without actually killing themselves in the process? And could government actually do something to improve on their own spending? And it's surprising, of course, to note that the people from abroad, I don't know, for external funders, they pay more, 14%, and our government is paying only 3%. But when we are talking about our government paying 3%, where's the money coming from? The money comes from, still from the citizens, from the taxes and the activities they carry out, the economic activities. It's not like government has some money locked up in the ceiling somewhere that it brings down like coconuts or something like that. No, it's the wealth of the nation, or the budget comes from the amount of money that everybody kind of like generates at the end, and then it goes into the government coffer, and this part is allocated for health. We are saying that we could do something, look at some other ministries where we are wasting money, take a little bit from there and add to the health budget.
I see. Thank you. So, in summary, if the government health expenditure is considerably raised up, it is going to reduce the out-of-pocket health expenditure, which will work better. Because when we talk about healthcare, it is not free. It is saying that our out-of-pocket should be reduced and we are financially protected. If I'm sick, if a mother is sick, going to the hospital, she should be able to treat herself or her child without feeling the burden much.
That's right.
Thank you.
That would be an utopic situation. The utopic situation is where they just walk in and walk out. But we are saying that at this material moment, government should be doing something and increasing the expenditure from our own side, so that the expenditure on the sick individuals and the family should be dropping. But there are mechanisms of achieving that even without spending a penny, and that's what we should be working on. There are mechanisms of us, we can do a lot on our own to cut down on healthcare expenditure without actually spending money. It's about organization, it's about redesigning how you do things, it's about redesigning how you solve problems, and it's about bringing entrepreneurship skills into the whole business. But if you can consider healthcare as a business. If you have that kind of business that is run by civil servants who have never sold groundnuts all their life, there will be a lot of wastage. But if you bring in entrepreneurial skills and so on, you'll be able to get value for money.
Okay.
So it is what we are saying is there's no value for money. But if you bring in entrepreneurial and managerial skills and do it properly, there will be value for money. That's what we're saying.
Thank you, Doc. Can you give a concrete example of what you really mean? For example, what will be done to...
Okay, let's say, for starters, there is nothing for free. Okay, there is nothing for free. There's no free lunch. It doesn't exist anywhere in the world. The only thing that we have free is oxygen and sometimes water. And even the oxygen, when you're sick in hospital, you pay for it. So there's nothing free. There's no free lunch. So that said, we have a lot of resources, and we should be able to use our brains to put those resources to effective use. Now, let's say that the government has $100 to spend on healthcare. Let's look at the budget and see how that money is used. You will see that some of the money goes into importing medication, importing disposables for hospitals, instruments, machinery, training health personnel in the country and abroad, and then preventive healthcare services. So all those services. And if you look at it very carefully, if we went and looked at that budget, so unfortunately I don't have it, we would like to see where most of the money goes to. That's where we should be working on that. The Pareto's rule, the 80-20% rule. So we should look at the 20% of the healthcare expenditure where 80% of the money goes to, and then try to do something about that, then we'll correct the system. And if you look at it very carefully, you see that most of it goes to the buying of drugs. And then most of it paying healthcare personnel. And some other issues would be like equipping and then from new health facilities. But again, a huge percentage of that, when someone says I'm asking for $20 to buy drugs, in fact he's buying the drugs only for $12 and $8 is stolen. So we'll have to look at that one which is not written anywhere, the theft, and see how we can correct that. But this is what we ought to do. If you want to change the economics of a whole nation, or the economics in your family, so we'll be talking about economics in our individual families is the same principle that work in the economics of a nation or of the continent, whatever. The problem is, the thing is this: when you produce it yourself, it is cheaper. Do it yourself. But in Africa, in our country, a lot of people have been complaining of the do it yourself, that sometimes when we do it ourselves, the unit cost is more than what is imported. That is true to an extent. And we try to use that as a cover-up to go for importation, because through importations we steal. This is how it works. You have to put in place all the principles of economics, the principles of scale. I have forgotten that. But if you do mass production, it's cheaper.
Yes.
All right. If you do mass production, mass delivery, and mass whatever, it's cheaper. If you were to produce drugs to a good quality, then you sell them en vrac, as they will say in French. You sell them as in large packs.
Yes.
In large packs, instead of packaging them in small little packs and so on. It's always cheaper. So the thing is, let us get the active principles for the drugs.
Okay.
Buy the machines for producing the drugs.
Yes.
Bring them home. We have more than 500 pharmacists that trained abroad and came to Cameroon, and they're selling drugs. They are the counters selling drugs for European companies. None of them can make a tablet of aspirin. That is wrong. So take them and reconvert them to be able to make the drugs. Give them the equipment, give them the active principles, and they make the drugs. Then that stops your importation, that gives them job, and then you see that the drugs that we buy in the pharmacy, not in the pharmacy, yes, in the pharmacies for about 10,000 francs. You can actually get them to the patients at 500 francs. It's true. There are some molecules like piroxicam. Piroxicam is very cheap, but it's a very effective drug, and you need to see the cost of piroxicam in the pharmacy. But you see that piroxicam that is sold as generic is very, very cheap. I mean, it could be cheap in the sense that it's a bad one, but I'm talking about good piroxicam, tablet, capsule, or injection that is sold out there in generic form, and it's very cheap. But when you see it, that has been packaged and is selling in the pharmacy, coming from some particular laboratories, it's so expensive that you cry. So that we should work on that. And then You remember last time we were talking about things like intravenous fluids?
Yes.
Intravenous fluids. It's so stupid that we import water with solutes in it from China, Europe, America, and so on. I'm talking of normal saline, dextrose, and the other drug liquids that we inject, that we infuse in patients. We should produce those locally and create jobs for people. It will be so cheap. For now, for instance, a 500 mils unit costs around 500 francs in a pharmacy. But if you want to produce it, it will not be more than 150 francs. Yeah, and then take the cost of distribution around and so on. So by the time it was getting to the patient in our community, it should not be more than 250, and that would include the gains made on the stuff by the different handlers along the way. So we have a way of doing it, just that it could be done without spending any money, and we cut down on healthcare. So it's just demonstrated to be there's just a lot of wastage. We're just feeding others. We're taking money, punishing the mothers, and then we are feeding other people. We could just use our brains, and we'll be able to survive. And even by doing this, we could even cut out on subsidies from abroad, and we'll still survive, provided we do the right thing.
Wow. Thank you very much for those great insights. I mean, you have already answered the question on how we can improve and ameliorate our spending for healthcare. I mean, funding for healthcare in Cameroon as a whole. So, Doug, I will ask you this question. Have you ever find it difficult to pay for your healthcare? Maybe you're sick, you go to a hospital, or even at your hospital.
You want to know if I've ever
had difficulty to pay
for my health bill?
Yes.
I'm 65 years old, but interestingly, I've never been sick to the extent that I need to go to the hospital.
Okay.
Well, as a doctor, I have little headaches, malaria, and so on, and I take my own medication.
Okay.
I don't look forward to going to the hospital
So now,
soon.
the question.
But the truth is, I always get anxious about people going to hospital. I always get anxious if I have to go to hospital myself, because the way our hospital is structured for starters is problematic. It's problematic in the sense that, in a well-structured hospital, people should be able to work collaboratively in departments. So, and the health structure in a whole nation should be structured in such a way that you have first preventive medicine, which we don't have. Our preventive medicine centers are very poor.
Yes.
But besides the preventive medicine, we came over to the curative medicine. We should have, primary healthcare services. We should have regional or divisional hospitals, then regional hospitals, and then referral hospitals in the big cities like Yaoundé and Douala. But interestingly, people don't work in teams. There's lack of teamwork in hospitals, to the extent that, if you were to come to a general hospital and you come to the surgery department, you want to see a military kind of structure where you have the top surgeon at the top, or some professor at the top, or some other professors below him, and so on. So that when they are solving difficult problems, it's a college of people doing it. So they come in the hospital more often than not in shock, and you have to bring them around, and more often than not you will not succeed. So there's a huge problem there. There's a problem of education. And then the problem of preventive medicine. Preventive medicine is not being taken care of. You see, like now we have cholera outbreaks. But those are things that could be prevented first by education, secondly by vaccination, and then providing tap water, making sure there's hygiene and sanitation when it comes to food, all these things, toilet. So it's very surprising that while the whole world is screaming about COVID-19, we are still talking about cholera here, which is, if you were to compare the COVID-19 germ to the size to the cholera germ, it's like a rat at the moon. And so we should be able to handle cholera easily, but you see, we are unable to handle it, which is a pity. So we have a lot of things that we can do to help us, and we are not doing them. And I'm just saying that if we could improve on our understanding of preventive medicine, and then help the population to be part of preventive medicine services, and it's a collective thing in fact, then already we'll take care of a lot of our problems. Like for instance, I keep saying that the way disease patterns are, 70% of the diseases in our developing nations are infectious, while 30% are degenerative diseases. But when you go to the white man or country, as we could usually put it, to developed nations, 70% of their problems are degenerative diseases and organ diseases. You're talking about heart failures, diabetes, all those kind of things, cancer, high blood pressure, those kind of things, trauma. But when you come to us, it's infection, infection, infection. So if we could do a lot to prevent the infections, we'll be healthy. So it's just about organization.
Okay, thank you very much, Doc. What can you say about antimicrobial resistance?
Oh,
which is a silent pandemic.
Yes, there are two problems there. Number one, people don't go to the hospital to have a proper diagnosis before they take their antimicrobials. That's the first thing. Then the second thing is there's so much being sold on the streets everywhere, and we don't know what they are. And more often than not, even some of the tablets that are sold on the street, the active principles in them are not what the packet says. Sometimes they're completely absent, or they might be just about 25% or 50%. And usually, and also when people are taking medication for something, if you have to take antibiotics for, let's say, a week or so, and then continue to take even when you're well, depending on the germ you're curing, most people will take antibiotics for 2 days, 3 days. If they're feeling better, they stop. So that creates a problem in the community.
And there is a need for a lot of sensitization,
Yes.
information,
Yes.
education, communication on these matters.
There's so much that we need to do.
Thank you very much, Doc. And my last question would be, what message do you have for the youths?
Oh yeah, when it comes to the youth, that's a very exciting package. The youth in our country are they make about 65 to 70% of the nation is made of youths, and we need to do a lot for these youths to, number one, build up their capacities. Number two, have jobs. Number three, follow their development, get married, build their own homes, and build their own careers and so on. And the biggest problem and challenge in Africa has been that the white man gave us the wrong kind of education. The education that we were given allows us to read and write. That's even when we can read and write. But it doesn't give us creative powers. We don't have creative thinking abilities, and that's a huge problem. And the kind of education is devoid of STEM, science, technology, engineering, and mathematics. It's more of literature and a lot of things. And so we talk a lot, but we do very little, we achieve very little. And that's not the kind of education that will help us about. And so I'm hoping that African countries will change their education to be STEM based, and to that you add entrepreneurship, financial leadership, financial education, and many others, so that agriculture, food transformation. Oh, by the way, while we are talking about medicine, we need also to bring about agriculture. It should be industrial agriculture, so that people have enough quantities of good food to eat, so that they are healthy. It's very important. We should have some food security and have good sources of water.
And with all of this, we're going to have a strong national public health security.
Yes, that's right. It's not just about receiving money. There are a couple of things, lots of things that we have to do, so that when we are getting money from abroad, it adds value, not that it gets lost into a deep pit.
Thank you very much. It was a pleasure talking with Dr. Nick Mwanyam, an esteemed health leader in Cameroon.